Okay, so this is Three Gals and a Guy podcast. Okay, so we talk about diseases that people are wondering about. They ask us questions, and we try to answer them to our best of our ability. So this is.
I'm Sherry Matthew.
I'm Karina Macias.
I'm Nubia Maldonado.
And I'm Joshua McLucas.
Okay, so today's disease is CAD, Coronary Artery Disease. We had many questions over this, so we're gonna try and answer some of these questions. One of our first question is, I know what CAD is, but am I at risk for it? Sherry, can you answer this for us?
Yeah, okay, so I'm going to go through the epidemiology. So for culture and ethnicity, so we're going to see this, the highest incidence of CAD is in white middle-aged men. In African Americans, you're going to see this at a much younger age, so about 35 to 64 years old. And Native Americans will have the worst incidence of CAD because they have major modifiable risk factors like tobacco use, hypertension, obesity, and diabetes mellitus. Hispanics, on the other hand, will have the lowest rates of CAD than any other race. For age-wise, after about age 65, the incidence of men and women will equalize. So men and women will both have CAD around the age of 65. Genetics-wise, family history is a really big risk factor for CAD and MI. Most patients that come in with angina or MI will be able to name a parent or sibling who has died of CAD in their lives. Gender-wise, I also said this before with age, men will be more prone to CAD around the age of 65, and after 65, you're going to see more women who are more prone to CAD. Distribution-wise, the American Heart Association estimates that 1.1 million Americans have an MI each year. Every day, 2,200 people die from heart disease, and nearly 800,000 Americans each year will die. So that's 1 in every 3 deaths. So how is this relevant to HBU students and faculty? So I'm going to be putting up little graphs that are going to be picturizing the breakdown of percentages. So for our student body, 28% is Caucasian, 26% is Hispanics, 20% is African American, and 13% is Asians. And for our faculty, the breakdown is Caucasians are 68%, African Americans are 10%, and Hispanics are 10%. And for gender-wise, our students, male is 38%, female is 61%, and for our faculty, female breaks down to 50%, and male is 49%. So this is really important for our faculty of HBU, who are Caucasian males around the age of 65 will have a higher risk for CAD. And the chronic condition of CAD is arteriosclerosis, and this is the buildup of fats in the blood vessels, which will cause hardening of the vessel over time.
Okay, thank you so much, Sherry. So for our second question from another listener, it says, what kinds of signs and symptoms can I experience if I do have CAD? Okay, so some of the clinical manifestations at the early stages will not be present in most patients. They will be asymptomatic. So, but in the later stages of CAD, you can have anxiety, fearfulness, restlessness. You can become cool, clammy, and have pale skin. Some people may have tachycardia, some people may have bradycardia. Some will have low or high blood pressure depending on the patient. Symptoms can be different on each patient, and just make sure to go to a doctor and so they can diagnose you properly. Okay, so some of the risk factors she mentioned, so I'm just going to go quick in the list. We have non-modifiable, which means that you can't change those, which are age, gender, and genetics, which is basically if you have it in your family history. If you have any heart disease in the family history, you're more prone for CAD. Okay, so she talked about gender and age, so we're going to keep it as that. And modifiable risk factors, we have high cholesterol. If you have high cholesterol, these are things that you can change. So by lifestyle changes. Also, if you have low LDLs, that's what you want. You want low LDLs. You do not want high LDLs. That's not good. Okay, and then HDLs, it's the good cholesterol. You want high amounts of those, not low. Okay, and if you have high blood pressure, diabetes mellitus, high blood pressure basically is hypertension. Also, if you use tobacco, just stop. If you have no physical activity in your daily lives, incorporate it. That would be a way to modify that. Obesity is a big one too for CAD. So those are the modifiable risk factors. We also have some diagnostic tests that can help the doctors see if you do have CAD. We have the history and physical examination, the x-rays, the EKGs. We have the lab tests, like I said, for lipid profile, for cardiac markers as well, CBCs, echocardiogram. We have the exercise stress testing, and we have the cardiac catheterization. So for some complications for CAD, we have the stable angina, which is when you have pain on exertion. So we can, it can be relieved by rest or nitroglycerin. The unstable angina is when you get pain in the chest at rest or exertion. So, and this is not relieved by rest or nitroglycerin, so just call 911. And another one is myocardial infarction, which is heart attack. Okay, so now let's move on to our third question. So our listener said, me and my boyfriend were kissing, and he was diagnosed recently with CAD. Can I catch the CAD? What do you think, Josh?
Okay, Nubia, I'll take that one. The answer for our listener is no. You cannot catch CAD from someone. The only contagion or communicable part of it is giving it, passing on to your children through genetics. Now that leads me into my next topic, which is prevention strategies. The main prevention strategy I'm going to talk about is lifestyle changes, such as quitting smoking or avoiding people with secondhand smoke. If you have friends who smoke, you probably want to find new friends. Exercise, it's going to help improve cholesterol levels, decrease blood pressure, and maintain a healthy weight. The American Heart Association recommends that you get 150 minutes of moderate exercise per week. You can divide it up however you want. If you want to do all 150 minutes in one day, go for it. You want to also eat a heart-healthy diet. You want to eat more vegetable sources rather than animal sources. And it'll help maintain a healthy weight and reduce stress on your heart. You want to manage other problems such as other health problems such as diabetes mellitus, increased blood pressure, also known as hypertension, and increased cholesterol, which is hyperlipidemia. You want to ask your doctor about aspirin to prevent clots from forming if you are at risk for coronary artery disease, such as your mother, father, granddad, uncle, anybody in your family who has had coronary artery disease puts you at risk. And then you want to reduce your stress. Stress increases the workload of the heart and it will begin to wear it down as it beats faster through tachycardic episodes of anxiety. You want to keep your stress low by talking about your feelings and problems rather than keeping your feelings hidden. Thank you, Freud. Try different ways to reduce stress, such as exercise, deep breathing, meditation, and yoga. When we talk about treatments and goals of treatment, the treatment goal for a patient with CAD is to relieve the symptoms of CAD and then to prevent future cardiac events such as unstable angina, acute myocardial infarction, and death. The treatments includes nitrates, beta blockers, calcium channel blockers, statins, and ranolazine. The prevention and control of atherosclerosis requires control of known modifiable risk factors, just as Nubia was talking about. This includes therapeutic lifestyle changes and medical treatment of hypertension, hyperlipidemia, and diabetes mellitus. Fortunately, the natural history of CAD is characterized by early onset and a long dormant phase. This provides an excellent opportunity to intervene in order to reduce the number and severity of cardiovascular events. So, from what I've talked about, this sounds like it's going to be pretty expensive. So, annually, about 1 in every 6 U.S. healthcare dollars is spent on cardiovascular disease. By 2030, annual direct medical costs associated with cardiovascular disease is projected to rise to more than $818 billion, while lost productivity costs could exceed $275 billion. Wow, indeed. After a patient has had a heart attack, they will have direct costs such as ambulance diagnostic tests, hospital charges, and possible surgery. Long-term maintenance of heart disease costs include drugs, testing, and cardiologist appointments. Indirect costs includes lost productivity and income, though many people return to work after a few months. it is estimated that a person will spend $1 million for a lifetime treatment for coronary artery disease. So the main treatment goal is prevention. Don't get it. Stop eating steak and potatoes and butter. That's all I have.
Okay, thank you, Josh. So for our last question it says, what are some ways to maintain proper treatment after being diagnosed? So what do you think of that, Karina?
Okay, so ways to continue long term would be to participate in a long-term rehabilitation service, which can be found at a local gym or outpatient clinic. Outpatient clinics can be found at any of the Memorial Hermann Wellness Centers, the St. Luke's Woodlands Clinic, and then the St. Luke's Clinic in the Medical Center, and then any additional clinics will be provided in the description box. What these services offer are it's a maintenance program, so you continue lifestyle changes through an exercise regimen, nutritional counseling, modifying risk factors, stress management, medication review, and smoking cessation awareness. And the importance of continuing a long-term rehabilitation service is to prevent progression of coronary artery disease and maintaining lifelong heart and healthy habits to improve your quality of life. Benefits that you can gain long term would be to improve your physical fitness and awareness of heart disease, and improve your emotional well-being and self-confidence. Coronary artery disease patients tend to experience anxiety due to concerns of what the future may hold for them, such as exacerbation of their disease, death, and then they also may experience anxiety during their hospital stay, or just being overwhelmed with their current health state, and then they may also experience depression, such as being a financial burden upon their family, and having to change certain lifestyle behaviors such as their diet and activity. You can also share these concerns with your healthcare provider, or speak to a friend or family. And then you also want to do relaxation therapy to reduce these stress factors, because they can potentially exacerbate coronary artery disease. And then also an important way to learn to cope is to join some support groups. So some support resources are the Mended Hearts, which is a nonprofit organization affiliated with the American Heart Association. And this is directed towards patients, families, and caregivers. The Women's Heart Group, and then there is one for Houston, and then the Daily Strength. And then links will also be provided for these.
Okay, yeah, those links will be provided in the description below. Okay, so look at them if you need them. Okay, I hope we answered all those questions for all our listeners. Thank you so much for listening, and just remember, those modifiable risks, try to change those lifestyle habits. Like he said, stop eating those steaks and butters and then extra butter, and just take the butter out of the refrigerator. Just take them out and try to live a healthy lifestyle. Okay, so thank you so much. That will be it.
Bye.
Bye.